Perfect Week is about all the health and social care community coming together with a shared purpose about making it better for patients. So all of us freeing ourselves up to go that extra mile to make it better. For me, the measure of whether Perfect Week is successful, it's about making sure that regardless of how many patients attend the hospital, we can manage them really safely and calmly, and that all of the staff are working together with a common purpose and are on it. They're on plan each and every day, and that they're communicating well together, and that there's good feedback at ward level so the wards understand what's happening and what we're doing and what our successes are.
Some of the frustrations that we've had have been around there's a potential just to accept that a problem stops people going home, or it stops people getting the care that the next stage in they require. I think what this has allowed to happen is to be able to identify those frustrations and not accept that they're there, but to challenge why they're there and largely do something about it, I think, as well. That's been a big positive.
What has surprised us is some of our preconceived ideas shouldn't be preconceived ideas anymore, and we're collecting the evidence to suggest that what we've thought were delays in the past are perhaps not the delays that we expected.
I think the thing that's really surprised me is how well it's worked when it comes to getting patients through the department quicker. You make an initial diagnosis of a vasovagal or a back pain, and the patient can have some painkillers or be sat out in a chair in the waiting room and be home half an hour after arriving.
Well, I think it certainly highlights things that I see on a daily basis in terms of the work in the acute medical unit. We constantly face issues about throughput and discharge and speed of movement through the processes. But I think we've had better buy-in perhaps from some of our colleagues who wouldn't normally have such a focus on those things, and it's had a massive impact on our ability to get patients from the acute medical unit into appropriate beds.
I think we should have done this earlier. It's very clear that it was needed to assess what the evidence is as to what was delaying patients moving through, and it's absolutely fantastic now that we can get decisions made, because before that was quite frustrating sometimes.
As an admin person, a non-clinical person, I've found how complex the ward is and the different teams that come on the ward regularly all day long, and how difficult that is for the nursing staff to manage and keep a track on. Sometimes we have medical teams that come on and they don't communicate very well with the nursing staff, and so the nursing staff are not always kept up to date with any changes that have happened to the patient's care.
I think probably the biggest frustration for me is decision making, and ultimately that the patients that potentially don't need to be here perhaps being decided on the day of discharge when actually they don't need to be. Often these patients are in overnight knowing that if nothing changes they will go home tomorrow, but they often wait for particular contact on the next day before a decision is made to go, where actually if nothing's changed they probably could have gone first thing.
Perfect Week was always designed to be over 8 days so that we knew there would be a finish point, and that's a good thing, because all of the information that we've got, all of the evidence of what worked well, what didn't work well, it'll give us a little bit of time to understand what do we need to put in to make this sustainable, reliable and embedded into the way that we run the hospital. But what's a really important message is what we've seen this week. We've proved we can do this, and this will become the norm. But it'll take a little bit of time to get us there.